This is Dr. Anmol Chuk from Team Plasticos, and as you can see that we'll be interviewing the big man today. Hello everyone, I am Dr. Anmol Chuk from Team Plasticos, and we are back with the great man, the living legend of plastic surgery, Dr. Bryan Mendelson. Sir, it's an honor to have you with us at Plasticos. I mean, we are deeply honored for your time. Thank you so much.
It's very kind welcome from you, but it is a somewhat of an exaggeration. Well, I had the experience of being a patient with plastic surgery as a child. Mm-hmm. So, like many children, you fall off of the bicycle, but this was during a race along our street outside our house, and the road was gravel, and then someone called out car, so I was racing and pulled over to the left, and the thick gravel just slowed the bicycle, and I went over the handlebars and had quite a lot of trauma to the face, no broken bones, nothing serious, but it ended up with some scars on my face which bothered my mother, and so about a year or so later I had plastic surgery revision under general anaesthetic. Okay. With the doyen of Australian plastic surgeons at the time, Sir Benjamin Rank. Wow. So I thought I had plastic skin on my nose. That's what I thought plastic surgery was. And I was surprised later on when playing football to be perspiring through this plastic skin, not knowing what plastic meant.
Oh, that's interesting. So is that the reason that you chose face as your core area of focus and expertise?
Not specifically, no. I think just the face is so fascinating from many ways. I mean, they have a national portrait gallery, not a national body gallery in painting and so forth. So we just know the face is so significant. And then when you study the anatomy, it's it's so fascinating. Training after medical school was internship at the Alfred Hospital in Melbourne, which was rotating every quarter. Okay. Then I knew that I wanted to go overseas already for more training. So I decided rather than do 2 years as a resident and then maybe try to get my first part, I would do the 1 year, and then I was fortunate to be able to be accepted into Monash Medical School as an anatomy demonstrator, a year younger than usual. And so that helped me. Then, and then what I'm about to say is relevant, I think, for all young plastic surgeons, because, it's a bit embarrassing to say, but we had to do general surgery for 2 years in those days.
Back home also we have to do general surgery. Yes. And I think there are many places that we have to do general surgery before plastic surgery training.
And I'm fully for that. I just agree. Yeah. So when you talk amongst the residents, they say, well, the best place to go is like the Veterans Hospital equivalent, which is the federal government, because you get paid more and you don't have to work so hard. I'm embarrassed to say.
The most busy man is saying this. Yeah. Please ignore this.
But human nature being what it is.
Yeah,
but
exactly.
Then I was very fortunate that my father's a general practitioner, and the surgeon that he worked, who saw his cases, said, no, he must go overseas. Every step of the way, he's got to train with the best. Okay. So he was insistent, and then my best friend's father was the chief of surgery at the Alfred Hospital Melbourne, a major institution here. He had just come back from a travelling fellowship, whereas he trained at St Mark's in London, which is a revered institution. Yeah. He was most impressed with the training programs in the United States, and strongly encouraged me to go to the United States. Okay. And then my rowing coach at school, was a dermatologist, had just come back from the United States and the Mayo Clinic, and he strongly encouraged me to go to the Mayo Clinic. Oh. I didn't think that would be possible, but he said, no, we'll help get you in. And there I started thinking I'd be doing 2 years of general surgery, not realising that when you're in one of these training programs, you're there because they expect you to go right through to completion 4 years. And it was evident to me after 2 years that wasn't sufficient. And so I'm so pleased that I completed the general surgery and became chief resident and got my boards in general surgery.
So you are an American trained plastic surgeon?
well, that was American trained general surgeon first.
Oh, general surgeon first.
That was general surgery.
Uh-huh.
And I think the most useful training I received was from two of the general surgeons.
Oh.
About patient care,
Mm-hmm.
terribly fundamental, just so important.
Mm-hmm.
And there's no question what your priorities are anywhere along the way.
Mm-hmm.
You're if something's not right with the patient, you get help, whatever level it is, straight away.
Mm-hmm.
And then the technical aspects of surgery.
Mm-hmm.
One of them was very disciplined, trained surgeon, and the other one was a born magician.
Okay.
He paid his way through college and medical school as a professional magician.
Wow. Magician.
And, yeah, and that's really
That's
significant.
interesting.
Because then I'd heard about him,
Mm-hmm.
and of course the Mayo Clinic, there's a long tradition of outstanding surgeons
Mm-hmm.
because they select the best that come through the training program, and they all have a high volume of surgery.
Mm-hmm.
And the first time I walked into his operating theatre, and when there was a bit of time in another rotation, and then he was doing a thyroidectomy, and it was just so beautiful to watch, the organisation and the rhythm of it,
Mm-hmm.
and I had to stop myself from clapping.
Oh.
It was just so, produced that sort of response.
Yeah.
Well, then I was fortunate to work with him on 2-3 monthly rotations,
Mm-hmm.
and learned how to use the assistants. Traditional general surgeons were very good at that,
Mm-hmm.
how to handle the tissue so
Okay.
well. So I think, and his some of the classic papers that he had written was the anatomy and technique of radical neck dissection, the anatomy and technique of parotidectomy. Notice how anatomy was there,
Mm-hmm.
because he knew the anatomy so well he could anticipate
Uh-huh.
rather than just waiting.
Just
So
waiting
everything
for it.
was,
Yeah, so.
Look, I don't have the answer. I don't know whether anybody does. I don't really think
Mm-hmm.
doctors do have a good balance between
Mm-hmm.
that. And my father was a general practitioner, and we didn't see him whenever we wanted to. He had some days he was extremely busy,
Mm-hmm.
and most doctors work hard.
Yeah. So family
But-
get used to it.
Well, when a woman is marrying a doctor, it's only fair that she knows what she's getting into. So my father told my first wife,
Mm-hmm.
before we were married, did she realise what she was getting into? Because if something goes wrong with a patient, then no matter whether it's your daughter's birthday or what, you have to look after the patient.
Yeah.
There's
Patient.
no such thing. You can't, in all conscience, and you feel bad about it, but you just know that's what medicine is. Well, I don't know whether we really set out for fame,
Mm-hmm.
because I think most of us can't ever imagine it, and I didn't really. The fact that you use these terms is not something I set out to achieve, but I set out to satisfy myself about what we were doing, and having realised that I was given tremendous opportunities in life.
Mm-hmm.
My family situation, my father's
Mm-hmm.
motivation, the wonderful professors when I was in medical school, particularly the anatomy professor,
Mm-hmm.
and then the training at Mayo Clinic, and then the other surgeons who, the fellowship and I did at NYU, they all give, and then I think all surgeons need to travel as part of their ongoing training to visit surgeons, because a plastic surgeon is the way he operates.
Yeah.
And most surgeons are so gracious in receiving visitors and generously sharing what they have learnt.
Well, thank you very much for teaching me.
Yeah, that's right. So I'm giving back what I was the beneficiary of myself. And
Exactly. So
all knowledge is really because someone else helped us get there. That's my feeling about it.
that's a nice way of thinking, to give it back to your society.
Yeah, that's right.
That's
It
right.
makes it a better specialty. We love our specialty.
Yes.
And we have great camaraderie and respect for others. And the surgery that you do in India, I mean, there's so many challenges and complicated cases, and it's extraordinary what is being achieved.
It's good to discuss, learn from both the cultures.
Well, in my earlier surgical years, I really enjoyed motorsport. And there are many parallels between motorsport and surgery.
Wow.
which you may not think about, because you see, we were doing railing, but on tarmac railing, proper roads, not through the forest, but on proper roads. And so you had to be trained to be a driver, and then the driver training was extremely good, how they could teach you to drive. They had simulators, like you could drive on a circuit, and then they would flood the circuit, so you're driving on wet, slippery conditions, but in a safe way. And then trainers would train you to how to feel, like you could feel the feedback through the steering wheel of the car to the grip on the front, and that was like when you're going through tissues that just don't feel quite right. It's the proprioceptive response, so your blunt finger dissection is not just pushing hard, it's actually feeling what you're doing, so you're getting feedback of the tissues. Wow. And like from the magician surgeon and other good surgeons, you knew that they weren't just operating quickly because they were just ramming the fingers in, but they had the feel for it. Okay. And then also, to be the fastest round the corner, you had to drive in at the right speed and then brake slightly and then put the power on as you're going through the corner, but cut the apex at the right angle. And I often think when we're dissecting very close to the facial nerve branches, we're close, but not too close. So it's like one of my anaesthetist close colleagues, he flies private plane, his own plane. Okay. And again, the discipline for an anaesthetist and for a pilot is very similar, with checks and balances, step-by-step processes. Oh, he's very good, and he's a wonderful teacher.
That's the thing about great teachers. I mean, they tell you a lot of things, not about surgeries, but also about life.
Yes. I mean, and the other passion I have is for music, particularly opera. Not as a singer or performer myself, but I derive tremendous pleasure at times, and it's just a total foray into emotion. You know, we as surgeons we tend.
I thought that because when I was watching you operating, the opera was playing, and you were like just symphony. There was a lot of symphony, I guess. I mean, I think that works well for you, I guess.
It does, yeah. And I love operating when you have the rhythm of the surgery going, and then the music is just
the right
sort of strikes a balance there. But also we have a lot of pent up emotion, I think, because of our surgery, and we have to be disciplined. But you can sort of let your heart sing. When there's opera going on. I think if I had to choose one food, it would be Italian. Yeah, okay. Because they can maximise the flavour of the one or two ingredients and not complicated like French food. And sometimes simplicity is better than sophistication.
That's nice.
Maybe Italy or France or the parts of Australia are just just so beautiful as well. Yeah, doesn't have to be overseas.
So, not In Your Face, I guess. In Your Face, In Your Face, by the way, is a great book. I mean, if you haven't read, I mean, it's a wonderful book. You must see it, and it's a great book. And every plastic surgeon and whosoever is venturing into thinking of plastic surgery should read this, because it will not only give you great insights about human anatomy of the face, but also tell you about facial expressions. He has wonderfully described it. That's a must read. Sir won't tell you, but I'm telling you.
Yeah, or just to add to that, that book was written for the public, not as a promotional book, but as a way of explaining how the media portrays plastic surgery, and particularly aesthetic surgery, the wrong way. They're always showing Hollywood stars who've made a fool of themselves by having overdone surgery, and people who just fat lips and so forth. And I wrote that to reassure people that's not what it is. People are doing it for the inner self, not to show off. Now, a certain minority do that for the wrong reason.
Yes. One of the patients said to me that it's part of their healing process. I mean, it's good.
Well, I think because often there's a feeling of guilt about having surgery, changing our natural appearance. And now they're going to be caught out being sort of fraudulent because they're not wanting to tell people. But if you have a great work of art, it has been restored. but restored to look as though it hasn't been restored, as though it's original. and that's the same with when we operate on people's faces. No, I don't when you're busy in practice, excuse me, I don't think you really have time to band. But if I'm happy for people who do, because it shows they have an outlet and a passion. I think if you have a dream, it's a wonderful thing to have a dream, and if it's going to give you pleasure satisfying that. And a dream can be just like you can have a minor variation on the standard way of operating, and it makes you look forward to the next case, and you're trying it out, or a different way of dressing, or even a different way of communicating with patients. Plastic surgery offers something for everyone, as we know. So that some surgeons enjoy microsurgery, others craniofacial,
exactly.
And as long as you really love it, it shows, and the patients really like that the surgeon enjoys it so much. But one of the things I think for all residents to realise that the residency is the beginning, and it's the beginning that gets you into the right place. You know, you're so privileged to have finished the training and having good training, but then you can't stay at that same level. You've got to develop. And some of it's through personal experience, and then other training as you go and visit people or go to courses and so forth. Well, I guess obviously the right time is when you're feeling you're not as comfortable doing what you would like on the face that you should. So we have a basic course.
Okay.
And the key thing is if you learn something you learn in a book stays in a book, so to speak. And there's some quotes about that. But when you actually do the surgery on a cadaver, you walk away with confidence.
Okay.
And that's the important thing, is to move up that level of knowing you can do it. And then you don't just learn the whole facelift straight off. You learn the introductory part, that's the safest part, but you're learning spaces, anatomy, which is very safe, even though it's traditionally said not to be. If you know where you are, it's safe. And then having done that and seeing the patient without bruising, and the nurses say, "Oh, this is amazing, Dr. So-and-so, that the doyen of facelifts, his face is all bruised and yours are not." And that's wonderful for a younger surgeon. And to have that sense.
So for all of those, I couldn't attend this Mayfair course, and I'm definitely attending the next one. It's a very nice course, and I think it should be on your list. It helps a lot if you are venturing into facial anatomy and facial surgeries.
Yeah, it's no doubt. So it's really specific, designed to meet the needs of the younger people learning that.
So,
I would have liked to have had maybe a little more time in a few places.
Okay.
Just a few places that I visited. There's a little village, Lyon, just above Montreux, in Switzerland, and that is it's a little simple paradise. You get to the stage not being really impressed with things that money can buy, but it's a feeling that you get when you're there, and you feel as though you're part of the environment and you belong. And then we're in Lake Garda in Italy, where Giovanni Botti has his course.
It's a lovely spot.
Beautiful spot there, and you feel when you're there, you feel like you belong, and you don't really want to go away. Leave it behind. That's how you know.
Melbourne is lovely too.
Oh yes, it is. No, very nice.
It's a great city.
I think it's remarkable that the plastic surgery residents realises the need and having the satisfaction of fulfilling the need, and it's the whole production team, I can see, are very united and derive great satisfaction from that. But I'm sure for the residents who receive that and read it, they must feel motivated and as though they belong, because they're all going to be catching up at annual meetings and so forth anyway.
Definitely.
Yeah. So that's why I'm just so happy to share with you, because I appreciate your visit, and it's not just you personally, you're visiting on behalf of colleagues, which is very generous of you.
Exactly, sir. So it has been a privilege for us, sir, to have you on our interview, the Master's Mind as we call it, the guest interview. because we got to know what a beautiful mind and what a wonderful mind that you possess, and it's your initiative to give it back to the medical society, to give it back to youngsters like me. I mean, we are actually grateful. I mean, to learn from somebody you are actually inspired by, it's something very great. I mean, you must have gone through the same process.
I still feel young. I identify with you and your colleague's generation, because the time goes so quickly, and when you look, the only time you really remember is that beginning. I can remember going to a meeting and seeing in there the famous names. You read their articles in the journal,
exactly,
and you felt you had a relationship with them because you've spent time with their writing that they were giving to us. And I just almost had to stop myself from going up and shaking them joyously and thanking them.
So thank you so much once again, sir. Plasticos team is indebted, and I'm sure your interview will be loved by one and all. Thank you so much once again.
Thank you, Anmon. Thank you, Plasticos readers.